Good afternoon, everyone. And we can see that the aim of the talk is to encourage women to freeze early, and you get better eggs, you get more eggs. Don't freeze when you're ready to have a child, but when you can see where you're heading to in terms of building your family. So the message is clear from the MC and from the previous speaker, I beg your pardon. I'm now going to talk about not only the process, but also the benefits of social egg freezing. I will skim through the first few slides because they are topics that we have covered before, and perhaps you'll get the gist of it if I just get through it quickly to get to the main topic later on. So, let's see where I am with my slides, beg your pardon. So, eggs are a non-renewable resource. Human female reproduction is time-limited. Every egg in the woman's body is there since she was a fetus in her mother's womb, and at birth, she has about 1 to 3 million eggs. Those quickly become 300,000 when she reaches puberty. And every month thereafter, 30 to 50 eggs get ready to be fertilized, but only one makes it to the end of the line and the rest disintegrate. They will be lost forever. So what that means is that when we do egg freezing on you, we take those 30 to 50 that would have disintegrated and we freeze them. We don't tap into your pool. You go into the next month as if you never gave us any of your eggs. So it doesn't change your life forever. You will have your babies naturally, even if you need to, and you freeze these eggs for when you need them for your third child. So the next slide shows us that in fact, age and reproduction in women aging takes the reproduction in women in two directions. One is that the fertility rate decreases, that's the black line, and the red line is miscarriage rates increase. So as we age, two things happen. We get less fertile and we're more likely to lose pregnancies. So ideally, the best time to have your babies is on the left side of that slide, on the left of 35, where the fertility rate is best and the miscarriage rate is lower. However, we also know that people in this day and age want to postpone childbearing. And rightfully so. Women in the industrial world are postponing childbearing. Studies of birth rates per year amongst women of various ages shows that women are moving towards having babies between 30 and 44 rather than between 15 and 30. So have a look at this slide. So here this says fertility rates by age. It's actually also birth rates by age. And if you look at the last column, it's talking about growth rates. So the first three numbers are negative growth rates, which means numbers are going down. And the ages for those people are between 15 and 30. So people in their between 15 and 30 are having less children. And then in that column of growth rate, you can see positive numbers in the last three rows, and those are women between the age of 30 and 44 who are now having more babies. If you look at this next graph, it is about teenage pregnancies, and admittedly, the fact that teenage pregnancies are going down is a good thing, but I just used the slide to illustrate to you that less women are having babies in their younger days, and this is also in this case due to sex education and contraception, but we are illustrating the point that we have moved away from having babies when we are younger, and the following slide illustrates the same thing. This is increasing first birth rates in older age groups, which means that that blue line going up means that more and more women are having their first babies later in life. More women between the ages of 35 and 39, steadily year after year, more women are starting their families in their 35s to 39s, and even between 40 and 44, people are starting their families. So what's wrong with that? Because the delay in motherhood is related to some of the following reasons, and most of us are here. Later marriage, improvement in contraception and access to family planning, increased educational levels, greater number of professional women in the workplace, financial pressures to secure a good future for a family, and increased divorce rates. But what are the problems with delaying motherhood? So we know why we do it. We buy into this. What is the problem? The problem is that as we grow older, our eggs get older and they have more chromosomal problems. If you look at this slide, the green bars are the increasing number of abnormal embryos as we go from the age of 35 to 43. So more abnormal embryos are generated in cycles in women as we get older, and the blue bars are how many normal embryos we have, and that number decreases, as we can see. So the quality of a woman's eggs declines with age. That is clear. So the problem with where we are with that is the consequence of delaying childbearing is that a lot of people struggle then with infertility, with childlessness, with the inability to achieve one's desired family size, and also adverse outcomes like miscarriages. And also, what I didn't put on that slide is a very important fact, and they need to use donor eggs. So if you've left your childbearing for too long, you find yourself in a situation where you face all of these. So if we don't want to get trapped in this idea of I waited too long and I can't get past this hurdle, we need to avoid getting to that point. We need to plan ahead. We women of today who choose to have our babies later have to make the body cooperate with our choice. You can if you plan. And your planning should start early, not when you're on the brink of starting your family. So what is the plan? Is it reliable? Will it give me my babies? And how does it work? So the plan is egg freezing, oocyte cryopreservation. That's what we call it. This process allows you to postpone childbearing and to maintain the option of a biological child. That means you don't get trapped into needing to use a donor because your eggs are tired. Besides that, we also say that it is beyond experimental. So the American Society of Reproductive Medicine lifted the experimental label on oocyte cryopreservation in 2012, and since then, the use has increased by 880%, and that was a study that ended in 2016. So this speaks for itself. The lifting of the ban and the increase in use is testimony of the safety and the reliability of egg freezing. Results from scientific studies show that cryopreservation of your own eggs is a viable fertility preservation method that results in live birth. So we're saying, yes, okay, let's freeze, but will it get me to where I want to go? So if we look at two studies coming up now, they are from a reliable fertility journal, and this one shows live birth rates in different age groups, and those age groups are, the ages are when you froze your eggs. So all in all, what they're saying is that when we defrost eggs, when we thaw eggs, all ages will get up to a 39% pregnancy rate. That's the blue bar on the left side. But if you divide them into different age groups, you will see that your eggs, if you freeze them at 38, will give you a 51% pregnancy rate, live birth rate, actually not just a pregnancy rate, there's a difference. A pregnancy rate means that you get a positive pregnancy test, but all pregnancies that get a positive pregnancy test don't give birth to a live baby because somewhere along the line we lose the pregnancy. So this is actually the end result, the cat in the bag. So the live birth rate is better when you freeze less than 38, which is the first gray bar, compared to when you freeze after 41. So we also say that besides this, what about how many eggs do you have to freeze? So from the same study, this is another slide showing pregnancy rates if you have more eggs. Sorry about that, let's go. So I chose all ages because the slide was very complex. If we went through the different age groups, I wanted to make an impact with one line, and it shows in all ages, if you have 9 eggs compared to 20 eggs at the end of that line, you would have 24% pregnancy rate with 0 to 9 eggs, and 58%, twice the number of pregnancies with greater than 20 eggs. So the number of eggs you freeze is also very important. The next slide talks about the clinical outcomes. The clinical outcomes are how many pregnancies, what's the implantation rate, what's the live birth rate. And here they again talk about if we warm the eggs of women who had eggs frozen in a less than 35-year age group compared to 35 to 37 compared to greater than 37. So let's look at number of clinical pregnancies, which is the second line going down. And then let's look at the second last line going down, which is the number of live births. And take yourself across from less than 35 to greater than 37, and you see the difference in the number of clinical pregnancies when you are less than 35, which is 24. The number of clinical pregnancies if you more than 37, which is 6. So from that point of view, we're saying less than 35 performs better than greater than 37, driving home the same message all along: freeze early. The next slide is similar things. What they're saying is that of 989, almost 1,000 oocytes warmed, between 80 to 90% survived. So we know how to put them to sleep and we know how to wake them up. When you fertilize them, the fertilization rate, which is the first line, is also measured. And what they did in this study is they took a 36-year-old and used her fresh eggs, and they took a woman who froze her eggs at 36 years, no matter what age she was, and they looked at the defrosted, the thawed eggs and the fresh eggs and how they performed. And the results on both sides are fairly similar, showing that whether you take fresh eggs from a 36-year-old woman today or a woman that froze her eggs at 36 years old, you in essence freeze time. So you can get the quality of those eggs. Even if you've frozen them, they will wake up and they will perform the same as if you had them fertilized at the age of 36. So we know that you can freeze time and plan your pregnancies. So how does this process get done? Let's go there. This is a picture of a cycle, and we usually start at about on day 1 or day 2 of the cycle. Those little black holes on the sonar picture are the follicles, and those follicles contain the eggs. And as we said before, that each follicle is not going to be used that month. It is striving to become the dominant follicle and the one that will be fertilized. But if it doesn't get chosen as the dominant follicle, it will disintegrate. So that month, as many follicles as we see is what we expect to get after treating the ovary with medication. So the more we see, the better. And that's what happens with age. In the beginning, at the beginning of the cycle, when we see follicles, the number of follicles there tells us what the prediction is, in addition to all the other tests that you've heard about this morning, which is the AMH as well. So when we give you medication, we give you injectable medication up to 12 days, and then we wait for the follicles to be the right size, and we decide what day we're going to pick up. We give you a special injection called a trigger injection that makes the final ripening of this egg. When we inject, we do it for you if you need to come to us, or we instruct you on how to do it yourself. It's a small needle. It goes into the fat of your tummy. You don't need any expertise at all, otherwise we wouldn't trust patients to be comfortable and competent to do it at home. So it is fairly easy to do. It must be done correctly at the same time each day. We scan you to make sure that you are growing the right size eggs, and when we are ready, we trigger you and we pick the eggs out of your body in a process in a theater with an anesthetist giving you what we call conscious sedation. And the conscious sedation is not a full-on general anesthetic, but you won't be able to communicate with us and you won't feel what we are doing. When we work with you from the bottom. So you don't come out with any scars on your tummy. It's not an operation. The vaginal probe that we use to do the scans is exactly the device that carries our needle into the vagina, and from the vaginal angle, we are able to access the ovary. I have this picture, but we also have a short video, and I'm going to work on trying to get that going. There we go.
A needle is attached to the vaginal ultrasound probe. Both are introduced into the vagina Under ultrasound guidance, the needle is inserted through the vaginal wall towards the ovary and is introduced into one of the follicles. The content of the follicle is aspired and is passed through a closed circuit of tubes to the test tube. This test tube will be analysed by a biologist to separate the ovum from the follicular liquid. Once aspiration of the follicle is finished, the needle is inserted into the next follicle, which is then aspirated. This process is repeated until all the follicles have been aspirated.
I think we're done there. Okay, so the take-home message, freeze early to get better quantity and quality. Remember, we won't be diminishing your pool. We're not trapping you to be with us for the rest of your reproductive life. You can use frozen eggs for your second or your third baby, even if you don't use them for your first. And if you don't get to use the frozen eggs at all, they can be discarded. Freezing is a safe and successful technique. And the conclusion becomes, all these results indicate that oocyte cryopreservation is efficient, as evaluated by live birth and embryo implantation rates. It is, however, significantly affected by the woman's age at the time of cryopreservation, the number of oocytes warmed, and the sperm quality. A woman's age at the time of egg freeze is the most important factor affecting the live birth rate. The present and previous data show that women should preserve their eggs before 35 if they plan on relying on the frozen egg to have a live birth. The number of cryopreserved eggs needed to get to the best outcome is also important. Thank you.
What is the ideal age to actually start freezing? You keep on mentioning that before 35, but what is the ideal age to actually start freezing?
I would say that if you know your journey, because remember that life, everybody's circumstances are different. If you know you're a career person, if you're getting trapped into the world of working, if you have plans to reach a certain goal, and if you have not settled with a partner, I would say then you have a time frame in which to make maximum use of your eggs. It's difficult to say to a 22, 25-year-old, do it now, but the truth is that will be the ideal situation, because that's where we get our donors from, right? The donors are in that age group. So it means that we get the best quality eggs and the best numbers when we are younger, except that no 25-year-old is going to listen to you at that point. So they need to get to the point where they will cross that barrier for themselves. I would say if you see that's happening, you don't have the partner, you want to be the father of your children, and you're heading on a career path, even 30 is fine. But certainly don't head for 35, because inevitably it becomes 37, because then something else stops you. So plan, save, like you save to buy your car and you buy your house, plan and save so that you can do your egg freeze even at 30, even before 30. I would say 25 to 30, definitely not after 35.
Okay. Where's the mic? Could we have a roaming mic?
Doctor. My question is, what is the importance of egg freezing before going for cancer treatment?
So thank you for that. This talk and the one that preceded this, my talk last year, we chose social freezing. And social freezing is about women without diseases. But that's where cryopreservation of oocytes started, because we had cancer patients who needed to start chemotherapy in 10 days' time, and that's what we had to do. So yes, we get those from the internal system, and radiotherapy and chemotherapy affect eggs. So yes, eggs and sperm need to be cryopreserved before cancer treatment. Okay.
One last question. What is the financial, budget, even if it's not like the exact numbers, the exact figures, but if you can
Yeah. So what I say to my patients is that, first of all, private care in South Africa is very expensive. Medicines are expensive. That's your biggest chunk of the payment. Unfortunately, in Johannesburg, there isn't a government-run fertility clinic. Pretoria, Bloemfontein, Cape Town, there is. So when you are investing in this process, I say to the patients, you're not only investing money, you're investing time, energy, and you're investing psychological and emotional energy as well. So you need the best returns you can get for your money and your emotional and psychological investment. Because I know I'm deviating, I'm getting there, but depends on how many eggs. If you're investing and getting a good number of good quality eggs, then your investment is secure. But if you leave it too late, then whatever you put into it still doesn't give you the returns you want it to give you. So if you invest early, you'll even get past that barrier of so much money for so little return. And also when we stimulate you to freeze eggs when you're older, we use higher doses of medication. So you spend more money on medication. So the younger you are, the less medication you use, the better the outcome. And your investment is going to be not for one child. It will be for a few children. So from that point of view, it's done and put down and you pay that amount. In terms of what it costs, it can cost you anything from 50 to about 120,000 rand a cycle.
So you mentioned that the cost could be about 50 to 100,000 a cycle. What is a cycle? Is it from when the eggs are frozen until when I'm going to take them out?
Okay, so the cycle is what we do to your body to try and get the eggs out. So from the time you walk into the clinic and we give you medication for 10 days and we scan you, and then we remove the eggs from your body, and then we put them into the lab. So every aspect needs to be accounted for in terms of the fees. So you have medication fee, the doctor fee, you have the anesthetist fee, you have the procedure room fee, you have the lab fee, the needle that you use to take the eggs out. So all of that until the point that the eggs are out of your body, in the lab, into the liquid nitrogen. That's a cycle. That is not too much. I heard you. Thank you so much. I'll repeat it for the audience. What is the cost of storing them? So luckily, that is not too much. It's about between 1,500 maybe to 2,500 a year. Yeah.
Okay. Just to follow up from Ms. Karabo's question, what are the success rates after chemotherapy with pregnancy?
So the eggs that we take out will perform the way these numbers are. So as much as the talk was meant to be about people choosing to freeze and not people who were sick, when we take these eggs out of you for cancer or for social freezing, they will perform like the numbers I've just shown you. Then the disease process is another story, because what cancer did you have and what did we need to do? So the disease process may impact on how these good eggs can live in the body that is maybe needing continuous therapy, or maybe has had something done to it that's taken away from its energy to hold a child and take a child to term. So it depends on the disease, and it's not a question I can answer.
Okay, I have two connected questions. So the first one being, if I'm on a contraceptive right now, let's say the pill, would I need to wait, let's say 12 months before I come in? Or, what's the ideal period? And then following from that, let's say even with okay, yes, age is a factor that affects quality, but what about things like diet? In order to prepare for the best result at the time, would I need to maybe cut out certain things from my diet or exercise, etc.?
Thank you. So I'll start with the first question. And when you're on a pill, it is a myth that you need to have a couple months for it to work out of your system. In 7 days after stopping a pill, your system kicks in. So we take off directly from you stopping your pill, and about 4 days later, even before that period starts, we can start a cycle. First question. Second question is, so there's so much that we do wrong to our bodies, and I'm looking at the engine of the ovary, which is the most important of it all. So what I'm saying is that it goes without saying that every other thing, because I mean aging is, all of us are going to age, but every other thing that you and I haven't taken responsibility for in taking care of our bodies is going to affect the outcome. So whether we've been eating healthy, not sleeping enough, not having the right diet, maybe not exercising, stress, all of those play a part. We can't quantify it, but we've already gone so wrong that we're not even thinking about that anymore. We've gone down to, okay, what is the place that really matters, because there's so much else that we've done wrong. So I'm trying to say to you that there is no doubt that what you're saying is correct, and that we should all be doing that even before we embark on a pregnancy and the cycle. So you have to get your act together fairly quickly. Lifestyle changes are important. You can, because if you learn exactly what you're doing wrong, it needs your determination. One morning you wake up and say, this is it, I'm doing everything better. But your body will take time to adjust to what the new things you've done, but the mindset is our main enemy. So what I'm saying is that we've chosen to leave all of that out because people are not listening to that, and we've gone down to the very engine of it and saying, look, if you're not taking care of everything else that you're already doing wrong, at least care that your age is going to trap you. So everything else has already trapped us. So yes, there's a big commitment there. Even when you carry the baby in your body, that pregnancy needs to be healthy, so you need to have learned what to do to carry that baby. A lot of the science of it is showing now that what your metabolism is like when the child is inside you sets its metabolism for the future.
Thank you. Thank you very much, Dr. Patel. That was quite informative. Thank you.
Seven years.
8 years.
I did fall pregnant and I had a miscarriage.
It was the worst pain in my life.
I'm destined to be a mother. Your heart's become our world. We can't be silent about it.
Women don't want to talk about this. But what if we put our problems there for everyone to see, to help other people?
The Salome range of products tackle issues of infertility, menstrual pain, and heavy menstrual bleeding.